to COVID-19. So here what we are looking at is transplant and dialysis patients, which features quite prominently in our renal community. So even despite the availability of vaccine, there's still an unmet need for this group of population. As we see in our hospitals, 40 to 40% of these patients who are hospitalized, who are immunocompromised with the COVID infection, they do have these breakthrough infections, which is actually quite significant. So even though we have possibly seen this COVID infection being endemic, there is still a very high at-risk group in the community that is more prone to not only having a COVID infection, but suffer from quite serious COVID infection. Transplantation. Now, because of the reduced vaccine response due to their immunosuppressive medication, this group of patients are actually at risk. 46% of the kidney transplant patients actually have no antibody response after the 2 doses. And basically, we see that their anti-S1 antibodies are actually low in this community. Now, 8% of these patients who are taking anti-metabolite, basically, which is a mycotic, mycophenolate, or azathioprine, only has an antibody response after 2 doses of their mRNA vaccine. What about the immune response of these patients? After receiving the 2nd dose, there is actually a delay in terms of their there's actually a delayed response to their anti-S1 domain. As you can see here, that compared to the healthy individuals, the levels of their anti-S1 is actually low, especially even after their 2 doses. And here we see that the inhibition score in the group here compared to the kidney transplant population, compared to the dialysis population, the kidney transplant population don't appear to have a high inhibition score to the COVID virus. So this actually shows the data from 17 hospitals when they looked at 18,215 patients who are fully vaccinated transplant recipients, and then when they compared to the general vaccinated US population, they were actually 82 times much more higher to actually have breakthrough infections in this group. They are 485 times more likely to be hospitalized due to the COVID infection, and they are 485 times much more higher likelihood to actually die from the COVID infection. The renal dialysis population. Now, again, after the 2 doses of mRNA vaccine, the effectiveness of this vaccine is only ranged between 68 to 96%. As we know from the earlier studies, about a year ago, the mRNA vaccine do confer up to about 90, up to about the high 80s percentage. The Sinopharm vaccine were within the region of the 60s%. Patients who are taking immunosuppressive medication, in an electronic database that looks at observational studies, they included 25 observational studies that look at patients with rheumatoid disease, inflammatory bowel disease, psoriasis, and other immune modulatory diseases. 1 dose of vaccine actually confers a 73% seroconversion, but after the 2nd dose, only 83% seroconversion. And what is found that we all know now is that anti-CD20 therapy was significantly associated with low response rates, and this is, for example, like the rituximab therapy. And anti-TNF factor also shows that there is a trend, not significant, but a trend towards a lower response rate to the vaccine. The immune response of these patients receiving DMARDs measured after receiving COVID vaccine, again, they showed a decreased antibody response to the vaccine. As you can see here, for example, in patients with methotrexate, especially, that they see there are less likelihood to actually respond to the treatment. So I'd just like to give a quick sort of brief introduction to tiguerimab tixagevimab and cilgavimab. So basically, it's a two human monoclonal antibody binding on two distinct epitopes of the spike protein of the COVID virus. They are highly potent. They retain a very high neutralizing activity